Victims from this were still in critical condition, and joining me now to talk about how they're doing, some of them are doing, is Dr. Comilla Sasson. She's an emergency room doctor at the University of Colorado. Doctor, good morning.
Morning.
I know you can't talk about specific patient conditions or specific patient names, but are some of the patients doing better this morning?
They are. So we had 23 patients total that came into the hospital early yesterday morning, and we actually treated and released 10 of those folks now. So they're at home with their families. We still have 5 patients who are in critical condition, one who has expired at our hospital, so did die at our hospital. And then
that's within the last several hours.
Since the tragedy itself. And then we actually do have 7 patients that are just admitted to the hospital right now for observation.
Those patients currently in critical, all gunshot wounds?
Yes.
Okay. Mm-hmm. Tell me about the extent of some of those gunshot wounds and what made this particularly difficult for you.
You know, I think gunshot wounds are just a very different thing. You may see one bullet wound that goes into the chest or to the abdomen, but the sheer amount of force and the amount of damage it can do inside of someone's body is so tremendous. So what we had to do continually was just keep reassessing our patients every 1 to 2 minutes, because they could go from being very stable and having blood pressures that were normal, being able to talk to us, tell us what happened, and then crash within minutes. Where they couldn't tell us anything, they were completely disoriented and their blood pressures were down, and we had to start getting them fluids and blood products to get their blood pressures up. So gunshot wounds are just scary because what you see isn't necessarily what you get.
And you're talking about victims here with multiple gunshot wounds, as you mentioned. This is 2, 3, or more.
It depended on the patient, but yes, we did have a lot of folks actually who came in with multiple gunshot wounds.
Was there one particular story of survival that surprised you the most?
You know, I'll be honest, they all surprised me. Just that again, I think we're still kind of trying to process what happened yesterday, and you go back and think through what these patients, these people, their families have all been put through. The fact that we were able to even have 23 patients show up on our doorstep and had just this amazing response from the entire hospital coming down to help us in the emergency department. You know, the folks, we've lost one person and everyone else is actually still alive. I think that really speaks to the quality and the caliber of our hospital.
What takes place when that happens, when you get that word, when everyone has to rush downstairs?
You know, I think the reason that we were actually able to coordinate such an amazing response was because we had a disaster plan in place. And so we got that phone call in right at 1 o'clock, and within 15 minutes we had surgeons that were coming downstairs. People who weren't on call actually had come in specifically for the tragedy, and then we had custodial staff, nurses, technicians from all over the hospital who had come downstairs. And it was one of those things where actually, as an ER doc, we're so busy taking care of patients, it was really great to not have to think about the details. Everything just really fell into place.
Thank you for stepping away for just a minute here. We appreciate the work you're doing. I know the families appreciate the work you're doing. Thank you for updating us this morning.
Absolutely.
Dr. Comilla Sasson.